Hello, I'm Dr. Roffler, and this is Winter Park Spine and Injury, Disc Centers of America, Winter Park, and this is one of my special patients, Ellen. Ellen, I asked you right before we started, but tell us tell us what kind of symptoms you had when you first came in.
So before I came here, I was feeling like a pain on my low back for more than 6 months. And then the pain start to go through my leg and start to increase the intensive and everything.
And now you had previous neck fusion.
Yes.
I think you actually had 3 different vertebrae fused. Why did you come to us versus going back through surgery again?
Because in my experience, it didn't solve my pain 100%. Even though I went through the surgery, it didn't solve 100%. So I was looking for a more integrative approach and more respectful approach with my back that could heal like my whole entire back.
Okay. And when you were kind of in the thick of things, while you were having these symptoms, as far as the low back goes, how did that affect the quality of your life, as far as what you could and couldn't do?
It impacted in many ways. Like in my work, I couldn't work properly. I couldn't do chores inside of my home. I couldn't exercise properly. I could be sitting. I could go to a far place in an airplane because I would feel so much worse.
Airplane seats aren't the best to start with.
Yes.
And so, since you've been under our care, obviously you've gotten better. Maybe not perfect, but quite a bit better.
Yes.
And as far as the quality of life, what you can do now, how has that changed?
It improves a lot. Now I can do exercise. Now I can work much better. Now I can study. I can sit in like for 4 hours and I cannot like feel like the same intense pain. I can be a little uncomfortable, but not the same amount as pain that I used to have.
Okay, that's great. That's great. So, what would you tell somebody that wanted a alternative to surgery, as far as their neck or low back goes?
I would say when you have like a pain in your back, you should ask like 3 questions. Am I going to face all the reactions and the consequence of a medication? Am I going to face the risks of a surgery? Or am I going to treat my spine in a more integrative way, respectful way, natural way, and see my body healing through the time? And if the person says, yeah, I prefer going to this path, facing and experience my body healing through the time with a decompression, probably it will be the best option without the risks.
Without the risk, exactly. Okay, well, thank you very much.
You're welcome.
So, you've heard it from, I won't say the horse's mouth, but you've heard it from Ellen that if you're looking to maybe avoid surgery, avoid drugs, avoid the risk of surgery, and you have a neck or back problem, sciatica, that type thing, then look seriously into decompression, non-surgical spinal decompression, and give us a call. Dr. Rex Roffler, thank you.